Hello everyone, this is Ashrita, student of PharmD, and I am from Geetanjali College of Pharmacy, Chiriyal. Today, in this video, I am going to discuss about sedatives and hypnotics. Here is a picture depicted good night. Actually, what does it mean? In the current scenario, a lack of people don't have proper sleep and don't fall asleep due to work pressure, emotion and anxiety issues. Even though some individuals can get rid of it easily by doing other activities like yoga, meditation, etc. But there are some other people who can't get rid of this easily and need medication. In this case, here are the sedatives and hypnotics which causes depression of CNS and plays a key role in this type of individuals. So, let's see what actually are these drugs. Sedatives. Sedatives are the drugs which causes sedation, which may be defined as induction of decreased anxiety, excitement, or decreased response to stimuli without inducing sleep. Sedatives bring a state of relaxation, a calmness in hyperactive or overexcited patients. Simply, sedatives can be defined as the agents which reduce tension, excitement, anxiety, and produce relaxation. Whereas hypnotics are the drugs which causes hypnosis, which may be defined as induction of sleep just resembling a normal sleep. Here, insomnia is a sleeping disorder, which means sleeplessness is produced by various factors such as emotional trauma, tear, anguish, and any other diseases. Hypnotics are the agents which produce sleep to reduce emotional tension and anxiety issues in patients suffering with sleeping disorders. Both sedative and hypnotic drugs have same mechanism of action which may reside in the same drug. It means the difference is being mainly quantitative. At lower doses, the drug may act as sedative, while at higher doses, same drug can act as hypnotic. Here is the pharmacological classification of sedatives and hypnotics. They majorly include three classes: benzodiazepines, barbiturates, non-benzodiazepine receptor agonist or Z compounds. Benzodiazepines are categorized into four groups: ultra short acting, intermediate acting, and long acting drugs. Ultra short acting drugs include midazolam and triazolam. Short acting drugs include triazolam, eszopiclone, zolpidem. Intermediate acting drugs are alprazolam, temazepam, estazolam, and lormetazepam. Whereas long acting drugs include diazepam, clorazepate, chlordiazepoxide, quazepam, and flurazepam. Here, next class is barbiturates. It also categorized into three groups: ultra short acting, and long acting. Ultra short acting drugs include thiopentone, methotrexate. Short acting drugs are pentobarbital and butobarbital, whereas long acting drugs include phenobarbital. Z compounds are zalplone, zolpidem, and zopiclone. So, this is the classification of sedatives and hypnotics. Before knowing the mechanism of action of these drugs, first of all, we need to know about GABA receptor. GABA receptor is a neuroinhibitory transmitter. Here is the representation of GABA receptor. This basically consists of 5 subunits, in which there are 2 alpha subunits, 2 beta subunits, and 1 gamma subunit. We can also have 2 gamma and 1 beta subunit, but there all should always be a 2 alpha subunits in a GABA receptor. When GABA binds to its receptor, then it causes hybrid polarization of the cells in CNS, which causes depression, leading to effects like sedation and hypnosis. These both drugs like barbiturates and benzodiazepines have same mechanism of action with minimal differences. So let's see what are the common and minimal differences between these both drugs. Binding sites. The site for binding of drugs like benzodiazepines and barbiturates on GABA receptor is different. The site for binding of benzodiazepine is between alpha and gamma. When benzodiazepine is binded between alpha and gamma site, it will cause opening of chloride channel, and they cause the entry of chloride ion from outside of the cell to inside of the cell in CNS. Eventually, this will lead to hyperpolarization that disperses the action. Then the potential of the cell will become more negative and causes hyperpolarization. This causes depression of the CNS, and it will manifest as sedation, hypnosis, etc. This is the same basis for action of barbiturates and benzodiazepines for treatment of seizures. Whereas the site for binding of barbiturate is present either on alpha or beta subunit. The difference between barbiturates and benzodiazepines is barbiturates increase the duration of opening of chloride channel. So throughout the duration there will be influx of chloride ions that will cause prolonged hyperpolarization and causes sedation and hypnosis. Whereas benzodiazepines increase the frequency of opening of chloride channel. This is the basic difference between barbiturates and benzodiazepines. This is the common mechanism of action for barbiturates or benzodiazepines. When barbiturate or benzodiazepine binds to GABA A receptor at different allosteric sites, it will facilitate GABA A action, where barbiturates increase duration and benzodiazepines increase frequency of opening of chloride channel. This will lead to membrane hyperpolarization. Eventually, this would result in CNS depression. So now let's see what are the uses of barbiturates. The long-acting drug phenobarbital is used as epilepsy treatment medication, whereas thiopentin can be used as an anesthetic drug. But nowadays, barbiturates are not used as sedatives because of some adverse effects. Let's see some of adverse effects, which include hangover the next day when barbiturate is taken at night, dependent, as the patient may feel satisfied by the drug and gets addicted to it. Hypersensitivity reactions. While coming to the pharmacological actions of barbiturates, it is orally well absorbed, longer duration of action. Its plasma protein binding is 20%. It is widely distributed, metabolism in liver, whereas its plasma T half-life is 12 hours to 40 hours, and it get eliminated in urine. Some of the other side effects of this barbiturates include respiratory depression, megaloblastic anemia, and osteomalacia on chronic use. This is about barbiturates. Now let's see benzodiazepines. Here are the some of the drugs which are included in the benzodiazepines. The first drug is diazepam, which is very old benzodiazepine. Its effects can control anxiety, insomnia, and used as muscle relaxant, but not good, fairly muscle relaxant, and it is also used as an anesthetic and used in the treatment of seizures. Previously, diazepam is used as one of the drugs for treatment of status epilepticus, but nowadays lorazepam is used as drug of choice for epilepticus treatment. The next drug is alprazolam, which is used as preoperative medication. When a patient is undergoing surgery, this medication is given to relieve the anxiety in patients who undergo surgery. The next drug is midazolam. Midazolam is the commonly used drug these days, which has rapid elimination and shows shorter duration of action. The major risk of midazolam is dependence on chronic use. It is used as an anesthetic and anti-epileptic medication. In epilepsy treatment, midazolam is used as first-line regimen in especially pediatric patients. Most of the benzodiazepine drugs are used in clinical practice and day-to-day basis rather than like barbiturates, which shows adverse effects and are not used frequently in clinical practice. The next drug class of drugs include compound drugs. These drugs have more specific action compared to benzodiazepines and barbiturates because they act specifically on alpha 1 subunit of GABA receptor and causes hypnosis. So they are used in the treatment of insomnia, and as action is specific, there are no much other side effects. They show less anti-anxiety, muscle relaxant, and anticonvulsant effect. Advantages of these Z compounds include: they does not alter sleep pattern, they just increase the amount of sleep, and they minimal the daytime sedation. After taking the drug at night, the patient may won't feel its effect in the morning, rather than like barbiturates which causes sedation the next day. And low abuse potential. So this is about some of the uses, adverse effects and actions of sedatives and hypnotics. Thank you.